Hey everybody, welcome back to Around The Emirates podcast with Sara Mousa, where I speak to guests from across UAE about topics you want to hear about. Today I'm joined by the excellent Dr. Riham Afifi. Hi, Dr. Riham.
Hello, Sarah. I'm very happy to be with you.
I am so happy to have you on the show today. So, for everybody that tuned in last week, this is part two of a special two-part segment of Around the Emirates podcast with Sara Mousa, where we get to interview the amazing Dr. Riham Afifi, who is an ocular plastic expert. Such a cool and interesting word. Tell me your story and what got you started.
Okay, so thank you so much for having me. I'm super excited about this. I love my work and my specialty. So oculoplastic surgery, in a nutshell, is concerned with surgery around the eyes. So that is the eyelids, the orbits, which are the bony cavities that hold the eye and all the content which is in it, and including something which is called the lacrimal system, which is the tear drainage system, basically. So anything that concerns everything which is around the eye, this is the oculoplastics surgery. So. Uh,
What
uh,
got you into that?
what got me into that? So, to be honest, I took up oculoplastic surgery because nobody else wanted it. So I was the only female doctor in among a group of males, and I was always a very ambitious person, very competitive. So I thought, if I'm a woman and I want to make it big on in the middle of all these men, then I have to take what they don't want. So nobody wanted to do oculoplastics. When we had a patient who needed oculoplastic surgeon, we used to refer to another hospital. And so I decided, even though I know nothing about it, even though I don't really like it so much, I will study that. And I studied it. I went for training and a fellowship with that. And and I loved it. I found that it's an amazing specialty. And yes, I think I did make it big eventually. So
That's amazing.
this is how I got.
But it's so cool to work with the eye. Like that's like one of the most sensitive parts of your body. Like what kind of challenges come with that?
One of my very early professors during my pre-graduate said a very interesting word. He said that in the body, the only tissue that you can get a piece of half a centimeter by half a centimeter piece of tissue and talk volumes of books about it is the eye. And it's really true. You can get a very tiny half a centimeter and you can write virtually books about it. And I think this is one of the things that made me fall in love with eye surgery and all the medicine about the eye. And the more I studied it, the more I fell in love with it, and the more I found that it's a huge field, and it's very challenging, and it's very uh, delicate and sophisticated. So yeah, it's amazing.
That is so cool. So, I mean, of course, you've done multiple surgeries, multiple types of surgeries internationally as well. Is there any kind of story or experience that really made an impact on you as a doctor?
Um, yeah, I will tell you one. It's a story about me as a doctor, not as an ocular surgeon. But before my specialty, when I was in the very early years of training, I did 3 years training in the ER, so in the emergency room. This is part of our like compulsory training in Egypt. And working in the ER, I used to do like a 24-hour shifts instead of 12 hours because I wanted to empty my schedule to go and do some ophthalmic training or ophthalmology training after my obligatory work. So I used to like take a 24-hour shift and then go next morning to the ophthalmology clinic. So anyway, it's very tiresome working in the ER. And one time on my break, my mom got sick. So I had to take her to the ER. And of course, I took her to the ER where I was working. And when we went there, the doctor, who was my colleague, was treating her just like we were treating all the patients. And and there was nothing special. It was just a normal treating doctor treating patient. And I kind of found that I don't accept that happening to my mom. And I felt a little bit offended. And then I said, if this is how we are treating people, and this person could be my mom one day, and I'm not accepting it, then my treatment for other patients should change. And from that day, I decided that when I stand in and view a patient or deal with the patient, I have to think that it could be my mom, it could be one of my family. And I'm always thinking that, yeah, I mean, the greatness of the medicine, or the huge thing about the medicine is not that we have to do it for charity or something. It's that you have to have a heart and you have to have a lot of compassion, and yes, look at the patient and treat the person in front of you as if they were one of your family. And how would you like them to be treated? So I think it totally changed my attitude from then on.
I love that. I love how you look at it as it's not just because it's your job, but also human to human, understanding that this is a person in front of you, a person's life is in your hands, essentially. So it's not just for the sake of ticking the box and getting the next patient in. It's about how do you treat this person and make them feel like you are act like human to human at the most
Exactly.
basic level of humanity, supporting them.
Exactly. So I'm very happy, and I feel lucky that I've learned that very early in my career, and that I had to start the career with this mindset. I think I was lucky to realize that, and there is not a better chance than a practical situation than to really make you learn the lesson.
I love that. So I'm just curious, is there a fun fact that you can give us about the eye that we may not know?
Fun facts. Well, yeah, a lot of fun facts. Yeah. I can tell you that we have something in the eye that is it's a phenomena that is called an entoptic phenomena. So optic refers to anything that is related with the eye or with light, and N is inside. So there is something that the eye contains, which is called the entoptic phenomena. Entoptic phenomena means that it's a phenomenon where you can visualize structures inside your eye. So one of the things that you can do to be able to see actually the center of your retina, so the macular center that you can see with, and the vessels around this, the or the blood vessels around your retina, is just by closing your eye and pressing on your eyes a little bit, like if you're doing an eye massage and you press on it, and then after some time you will be able to see some the image forming into a kind of a web. If you study medicine and if you study about the anatomy of the eye, you will know that the shape that you are seeing, this is going to be the macula or the foveal spot, and you will be able to identify that God created it in a sort of a very thin avascular area surrounded by blood vessels around it. And this is really, it's always been amazing to me. Every time it happens, I feel my mind blows.
That is so cool. I love that I asked you that question. That's awesome. Thank you for sharing
Yeah.
that.
Yeah.
Wow.
Yeah,
Um,
I can do a whole episode on only the fantastic things about the eye. So
Go
let's
on. Give
let's
me
move
one
to
more.
another.
Give me one more. Give me one more. And I'll ask you my final question.
Okay, so what do you know the whole thing about the posts that where you get the black and white image, and then they tell you look at it for 2 seconds, and then close your eye, and then this is what happens. So it is because we have these pigments, and the more we look at one color, the pigments become saturated. So for example, if I look at a red object for a long time, and then after I close my eyes or I just turn to another red thing, everything turns green. This is because in the eye, red is the opposite or is complemented by green. Of course, this is not in light, but in the eye, the complement of red is green. So if you exhaust the red color in your eye for a very long time, like very, very strong light with red color, look at it for a long time and then look at another thing, you will see everything with a green hue. And of course the opposite with black and white and red and yellow and blue. So This is another fun fact.
I am mind blown. This is so cool, and I am so grateful that you were able to share this on my show today. That's awesome. Thank you for that. I do have one final question for you, Dr. Riham. For those out there that are listening that are considering entering this field, what final word of advice would you want to share with them?
I think I've shared the two main advices which I believe in. First, the compassion and really feeling what would you want, or how would you feel if you were the person in front of you. And the other thing, if a person wants to choose a career, yeah, I think with a lot of competition lying out there, it's always clever and smart to think that maybe you will love what other people don't want, because it doesn't mean that because everybody else doesn't want it, that it's not a fun or a beautiful field. It could be like a hidden treasure, if you will. And another very important thing I would love to say to everybody is that, especially females, that female doctors can be awesome. Female doctors really, the competition is fierce against men doctors, but women, we have grown to be sophisticated. Our minds are very sophisticated. We think of every detail. We are perfect, excellent at analyzing, which makes a great doctor. We are naturally talented with our hands and with our fingers, which makes great surgeons. So there's no reason for any female doctor to think that she's not uh, like apt to be one of the top performing doctors. And there's no reason for any patient to think that a female doctor would be any less than a male doctor. In fact, now I kind of believe it could be the opposite sometimes.
Thank you, thank you, thank you very much. Snaps for the doctor, for all the female doctors out there. Thank you so much for sharing that. I want to go to med school now at the age of 30 something. So you've inspired me to be a doctor. But thank you so much, Dr. Riham, for taking the time to speak
So
to me
sweet.
today. I
So
love
sweet.
it. I have such a newfound respect for my eyes and for female surgeons out there as well. Just thank you so much.
Thank you so much, Sarah. It's really been a pleasure, and thank you so much for choosing to make that talk with me.
Of course.
Love
Thank
you.
you.